Hi everyone, thanks so much for tuning into the channel. I'm here with Joseph, and today we're going to talk all about navigating home health as a new grad clinician. So, Joseph, tell us a little bit about your background, PT, non-PT related.
Yeah, sure. Alexa, thanks for having me. I'm excited to be here with you. I am from North Carolina and just recently graduated PT school at East Carolina University. Great program and great staff. Learned a lot and had a really good time in PT school. Had its ups and downs, but overall, it was a great experience. And then I just recently took the board exam with your help back in, let's see, it was end of oh gosh, I'm sorry. It was end of June.
Oh,
And then got started in August with home health.
awesome. And that's very recent. Like it doesn't feel like it, but so take us through like what your typical week as a home health clinician looks like.
Sure. So I think home health looks a little bit different than a lot of the other PT settings in the fact that there's a lot more autonomy involved. So there's a lot more flexibility with how you decide that you want to schedule things. And then it involves a lot of things both when you're with your patient and then when you're not with your patient. So with home health, a lot of the scheduling that you do, you have to do a lot of phone calls, a lot of um, scheduling patients in advance. So maybe on a Saturday, I'll go ahead and I'll call all of my patients for the week, and I'll try and schedule everyone and just have them know that I'm coming to see them. And then Monday through Friday, generally, I'm usually driving around and seeing patients. For me, it's within a typical 8 to 5 ish time period. But again, that can vary based on when you're available and when your patient is available. So I'll see patients throughout the day, help treat them. I generally see somewhere around 5 to 7 patients a day, depending on the complexity of the evaluation or what kind of visit type I'm doing. And then if I don't get through with my documentation, I usually just go home, whether I'm done or not, and spend some time with my kids before putting them to bed, and then I'll finish notes at night. Yeah.
Awesome. Yeah. And you had mentioned too that you have three kids for people that don't know. In your experience, how has home health given you that flexibility to spend time with your family?
Oh, it's phenomenal. There be times where our car will break down or something, or one of the kids will have an event, or we just have something that we want to do, and I have the flexibility to be able to allow myself to not have to treat patients during that time. I may have to make it up somewhere else, but to me that flexibility is very valuable. And kind of like I mentioned earlier, if I'm not done with my notes, and if I want to go home after I see all my patients, I can do that, and I can be with my kids, and I can just do it later in the day or something like that. So that's been very valuable to me, especially when they're young and want to be spending time with them and having good experiences.
Yeah, that's awesome. It seems like the would you say the pros outweigh the cons in terms of like scheduling patients like outside of working hours and then but then also being able to spend time with your family?
For me, yes, I think it's a two-sided coin. I think some
Yeah.
people may feel for them it works just to be consistent, 9 to 5 or whatever their time period is. And when they're in the clinic, they're working, and when they're not, they're not. But for me, right now, it works great, and I appreciate being able to have that flexibility so I can focus on things that are important to me outside of work as well.
Awesome. And for people that don't know, Joseph also has a business too. So could you tell us a little bit about your business that you are also doing along with home health? They're two different things, but
Yeah, absolutely. So I kind of started around the same time, maybe a year or two after you, Alexa, but started with the same coaching mentors, and have since been able to modify a little bit. But a lot of what I do is I help to coach triathlons. It's something that I'm passionate about and I enjoy. And then I also am able to do some different independent contractor work for different physical therapists too. with marketing and being able to attract patients to their services as well. So I've got a couple different things going on, but it all it it all actually blends surprisingly well together because of that flexibility that home health gives me to be able to do that.
That's awesome. It sounds like you have more energy because a lot of people, they might try to build a business like while an outpatient, but it seems like home health gives you the flexibility to do all of that and still have the energy to do all of these different things.
Absolutely. And I think too, an important part of it is that I'm not 100% on my business providing all of my money at this time. Like I have something steady that pays relatively well, and so I don't have to force business. I can be patient with it. I can have a long term mindset with it, which is helpful for me.
I love that you mentioned that because I 100% agree. I think it's super, it doesn't have to be like all or nothing. Like you don't have to be a business owner or a PT. That flexibility, it gives you the right mindset for business. But then, of course, you can also be a PT on the side. So, not on the side, but like a PT and a business owner. It's not like one or the other.
Yeah, I think with PT, you don't have to identify yourself as only a physical therapist. You can identify yourself as someone who provides money to markets or value to markets, and that might look like different things for different people. But if you are able to make the right connections and find a way to help other people in a meaningful way, then you'll be able to be paid what you're worth.
Right. And speaking of being paid what you're worth, if you don't mind sharing what your projected income for this year is, just because I think it'll help a lot of new grads just open their minds to what's possible.
Yeah, sure, absolutely. So, with home health, the way that my payment is structured is it's a pay per visit. So this is very much contingent on how much I consistently put in. But at the rate that I'm doing, I'm looking between like 13 to 15 a month um, in home health. And then I've been doing kind of building some of this side income now for about 2 or 3 years. I'm getting close to about 6 to 8 a month.
So you're killing it, is what I'm hearing.
Trying,
Yeah.
have longer term goals, and
Yeah.
hopefully this is just the beginning. But right now, I'm happy with where I'm at. Yeah.
Yeah. And for the people listening to this, I think it can be really like you can say like, "Oh, that couldn't be me," or "Oh, like that's so out of the ordinary." But I've known Joseph for a couple years, and this didn't just fall into your lap. You mentioned you had been doing business for 2 or 3 years now.
Yep.
What things in school did you start doing or not do that you feel like helped you put you in the position that you're in now?
That's really interesting that you would ask that. I think I learned just as much from the things that I wanted to do, but as I did from the things that I didn't want to do. So what I mean by learning from the things that I didn't want to do, I had multiple clinical rotations where I had PT clinical instructors that were phenomenal, that were absolutely incredible. But despite the incredible care that they were providing, it was kind of obvious that they were burnt out, underpaid, and not being able to pursue those things that were meaningful to them, like I was describing earlier. And so that was something that stuck out to me, and I kind of recognized early on in my PT school journey that I wanted to do different. So it really came down to deciding, if I want to have a different outcome, then I have to start doing something different now. So that's kind of, I would say, clinical rotations really got me thinking about um, wanting to do things differently. Yeah.
Yeah, that's a really good point. And I think that's a great reminder to all of us as students. If maybe your clinical isn't what you expected it to be, or maybe it was better than you thought, you're still in control of where you take your career.
Mhm.
And just curious, based on like home health is like seems like this unicorn as a student. We're not taught much about it in school. what skills would you say that you wish you would have been able to look at more as a student and feel like would help someone just starting in the setting as a new grad?
Yeah, so there's several. So I think that in terms of soft skills, communication is really the biggest one. Being able to communicate with your supervisors and with different physicians regarding patients and being able to communicate with patients themselves is absolutely crucial, especially when you're not seeing your supervisors and things every day. I'm usually by myself all day, except for when I'm seeing patients. In addition to that, I would say adaptability. So being able to figure out, you know, different solutions based off of different circumstances. It's not textbook in the way that we're taught, or at least that sometimes it feels like it seems in PT school. It's
Yeah.
not a multiple choice answer test anymore.
Yeah.
So even with the practicals that you take in physical therapy school, it's very like, okay, if you do this, this is probably going to happen. And so there's a lot of unexpected things that go on, and I would say the PT profession in general, but also especially in home health, um, more like clinical skill set though. I would say evaluation skills are very important. I actually rarely do treatment sessions because I'm evaluating patients, and then I'm prescribing plans of care that the physical therapy assistants are usually coming to the patients and doing.
Oh,
So a lot of what I have is subjective examinations. A lot of what I do is balance assessments, things like a tug score or Berg balance or things like that. So it, yeah, I would say like a lot of assessment, evaluation type skills are very important.
awesome. That kind of reminds me a little bit of acute care just because I was working in that
Mhm.
setting pretty recently.
Yep.
And have you had an acute care rotation before?
I did. Yeah. It was my first one in physical therapy school.
Okay, cool. Do you feel like it helped you for home health or like how did that work?
I would say acute was very helpful for getting ready for home health. I think acute can also be very much on the go. You never really know what to expect when you walk into a room.
Right,
Um, and then in terms of like medical acuity, it's to me it's very similar to like IPR. So
right.
I had an IPR rotation as well.
Oh, nice.
Um, I think the difference for me between home health and IPR is just the actual physical setting that you're in. In IPR, we had lots of fancy equipment and people and other therapists all around, and
Yeah,
um, usually when you're at home with the patient, you have like a walker and some stairs, maybe a wheelchair, and you got to figure it out. So,
yeah.
but yeah, I think acute care is also very good for helping to prepare.
Yeah. I love that you had mentioned that too, because I think, and I can understand the other side of it too, like for liability purposes, having someone that hasn't worked in the setting and is fresh out of school. But what would you say to a new grad that's thinking of doing home health and is maybe on the fence about not having that clinical experience in home health, but is still thinking about it?
Yeah, so I would say that the more that you dip your toes into different physical therapy settings, you can kind of start to tell that um, there are patterns and there are similarities in between each one. So there are commonalities, and it's no different in home health. And so if you learn how to really just master the basic clinical skills, you know how to communicate, especially when it comes to questions. Home health is definitely something that is doable and attainable. There's really no law or um, there's really no like formal set reason why we can't do it. I think it's just not as popular as a choice because we just don't know as much about it when we're in PT school.
Yeah. And I think a big thing too, like there's absolutely nothing wrong with like starting in another setting, like outpatient or acute, and then going into home health. I
Yeah.
think it really comes down to like, it seems like based off of what you said, confidence, and then also just your comfort with the setting, like, and also independence. So I think that's a big point that you hit on too.
Yeah, absolutely. I think, if you can get through physical therapy school and you, are able to pass your board exam and you feel like you have the the skills along with the clinical skills along with the soft skills, that communication, that adaptability, um, there's no reason why you can't do home health. I think it's very possible and attainable for people.
And I think something important too, I've heard in home health, and you can also clarify the type of help, like onboarding process for home health. Do you have like any advice for that? Things to look for in an agency, red flags?
Yeah, good question. So I would say for that, not all agencies are created equal. There's a lot of different demographics depending on where you are, and different agencies have different um, areas that they cover. So you may have to do a lot more driving with one agency versus another, which decreases your efficiency. Um, Different agencies will pay you different rates, or different salaries. And so, um, that's something to be aware of, is how much you're going to get paid. And then they may have different demands on productivity standards. So when you are looking at a home health agency, really what I was looking for at least was I wanted to be able to treat as many patients as I could within as small of an area and be able to have the highest pay rate for each patient. And so those were the factors for me. But I think if you can find an agency that is helpful with all three of those things, then it's definitely a good opportunity.
Yeah. Those are some great points you make, and you kind of learn as you go, kind of thing.
Yeah, absolutely. I mentioned I started this in August. I started in the end of August, and my agency is still um, kind of taking me through onboarding processes. They're still teaching me things. You mentioned, what how people can help be fully prepared to get into home health. I think also the truth is you don't have to be 100% ready. If you are willing to learn, and you make that clear that, hey, I'm doing the best I can, I'm adaptable, I'm able to learn these things, then they'll teach you and they'll give you the resources to be successful, because a lot of these agencies are understaffed and need help more than we think they might.
That's a really good point that you made. And since you like graduated so recently and passed the boards, do you feel like that having that background knowledge, like all the things that we learned in school, is helpful as going through this through home health?
Yeah, absolutely. And by background information, you mean just like general PTs,
Just
like,
kind of knowing everything under the sun for the boards exam.
yeah, I think
Um,
so. I definitely think that a lot of what you learn in the boards is kind of like a move it or a use it or lose it kind of thing.
Yeah.
Um, but I think the more that you get into the rhythm with home health, and I don't know for sure, but my guess is with other settings is that the more that you use those particular like narrower subset of skills, the better that you become at them, and the easier it becomes.
Yeah. I was just thinking that because I'm a travel PT, so I'm kind of on
Mhm.
the other side of it. I've done like two settings now, and I'm kind of trying every setting under the sun.
Yep.
So that's good to know.
Yeah, I definitely tip my hat off to you and all other travel PTs. Y'all probably have to um, really have that wide clinical sub skill and base, perhaps more than anybody, because you just could be treating a professional athlete one you know rotation, and then the next you're treating
Yeah.
whoever. So
Yeah. And I think anybody watching this too, like it's okay to be a jack of all trades. I used to think that I had to niche down to something, but like doing this, having this experience and having all these clinical more context than just being at one job, having multiple experiences is super helpful. So don't feel like you have to be niche down right away out of school.
absolutely.
So comparing and contrasting home health a little bit, these are settings that have on paper that will pay the highest and has the best return on investment from school. So we're just going to talk about it since we both had like different perspectives on it. So in terms of like, say you want to take time off in home health, how does that work? And on average, how much time off are you able to take in home health?
Yeah, I think taking a step back, it kind of depends on the payment model of home health because there are different models. So there's salary, meaning you're going to get X amount of dollars, and you have to meet this minimum productivity quota, and that's consistent, and that's what you're going to have no matter what. There is pay per visit, which you have to meet that quota, but if you want to go and do more, then that's fine. So you may have a little bit more variation in the amount of money that you get. And then there's PRN, which maybe most likely wouldn't be full time, but you could just kind of do visits as needed. So in terms of, sorry, remind me of the original question.
On like how much time off do you have? Does your company set?
Oh, yeah, that's right. So with so I am pay per visit because I thought that that would be able to help me generate the most money because I had additional time and wanted to commit to it.
Mhm.
So I think I get 3 weeks of paid time off per year.
Okay.
And so I can choose when I want that. I just have to notify in advance. I think that's pretty standard across all of the board. But the help that I get with paying for insurance and all sorts of different benefits and things right now too is really helpful for my family. While
Mhm.
also I it still feels like a little bit like a 1099 or a contractor position, even though it isn't, because if I do more work, I can get paid more. So it's a cool and neat balance.
That is really cool that you mentioned like that the more patients you see, the more, is it the more patients you see, the more money you make?
Yet
No, no.
sort of. So home health works on a different um on a different system. We have like a point system
Okay.
where basically each different visit type gets allotted a different amount of points. So, for example, um, we might have to hit 30 points a week, um, and one visit might be 2.5 points, and another could be like 1 or 2 points. So, for example, then one of these 2.5 visits um, would just be like you could do 3 of them in a day, and then you're well on track and beyond your minimum productivity. Or you could do like 3 patients like that, or you could do like 7 patients of a quicker visit. So the point system is different kind of than most other productivity standards.
I've always wondered what the point system was, so thank you for clarifying that.
Yeah, and I don't know if I did the best job describing it, but basically, um, each point is worth a certain amount of dollars,
Mhm.
and each visit is worth a certain amount of points. And some visits that are more complicated and take more time get you more points. It's all designed to be able to help you get help you provide the most value ultimately. And the more value that you provide, whether that's through treating more patients or doing higher complexity visits, the more money that you would be generating.
That makes a lot of sense.
Yeah.
I forgot what my original question was, but I think it had to do with like time off for like travel PT versus home health. So I
Mhm.
think just from what I've heard from other people, it seems like with home health, your days are more like, like laid back, like you have more flexibility in your schedule, whereas maybe in travel, you're working in outpatient and like more seeing more patients, but then you're able to take more time off in between contracts. So that's just kind of an interesting comparison between the two settings.
Yeah, how long do you guys typically take between different contracts?
So I've heard a lot of therapists, they take a month off after the contract. I
Yeah.
recently took 2 months off. I just kind of did 6 months, like head down, just working, and then 2 months off. So I like that split a little bit better, especially
Mhm.
with like international travel. But it really just depends on the therapist. I know a lot of people that just do not work 9 months of the year and then they still are able to support that time off in between.
Yeah, that's awesome. That's pretty unheard of in home health. Kind of like you mentioned, we may not be able to take that length of time off, but within each week we have a little bit more flexibility if we wanted to load up on patients one day and take it easier on the next or something like that.
This has been super helpful, Joseph. I hope this has inspired someone to just take the non-traditional route or at least know that there's more options out there in the field. And thank you so much, everyone, for tuning in.